This patient has previously had an intense pulse light treatment to her chest, and you can see that we're seeing rectangles of beautiful cleared skin, and around it you can see the sun-damaged skin. This is not a complication. This actually means that the treatment with intense pulse light is very effective for her sun damage. And that's why I always recommend patients have 2 to 3 IPL treatments so that you can come back and go over these areas and make sure it's very uniform. So we're now going to treat her chest. First, we put cold gel, coupling gel, onto the skin. This allows for an increase in the transmission of light through the skin so that you get good efficacy in absorption of all the sun damage. And with this patient, the sun damage is mostly a combination of red, excessive blood vessels, and pigmentation. We're going to be using a treatment setting that's going to be effective for both blood vessels and pigmentation. A double pulsing of 3.5 and 3.5 milliseconds. Because she's fairly tan, we're going to have a 20 millisecond delay between the pulses. And we're going to use cold air cooling. So we're going to come across the chest in an even manner. Ready? Trying not to overlap your pulses very much at all, but also trying not to have skip areas. And you can see the treatment goes very, very quickly. So a very easy, effective treatment.
So again, just a very thin layer of gel. It's always important. The tiniest amount of overlap, preferably no overlap, just to cover the areas. Very bright light, and do a little bit on your lip. Just mild erythema where we treated, which is perfect. So we treated right there. You can tell the vessel is pretty much gone. It seems to be coming back now, a little more purpuric. That's exactly what we expect. So now we're gonna get this little spot right there. Good. So again, I'm not pressing hard. I'm pressing so that it's right on the area, but I'm not trying to get all the blood out. This is the NDAG handpiece attachment to the Luminous M22. It has 2 spot sizes. This is really good for leg veins. You can just track them without injuring the surrounding skin. And so this locks right in, and within a matter of seconds, you'll notice some frosting right around the glass. That means it's getting really cold, but it gets cold fairly quickly, within a matter of a minute. If we're delegating the procedure, you can go to this preset mode. Now she's a type 4 skin, and we're treating leg veins, which are small. So these are telangiectasias, 0.5 millimeters to 1 millimeter. And the treatment area is going to be fairly small. Yeah, this is definitely conservative. We're treating veins on the face, we're going up to like 210, 215. But anywhere off the face, I'm much more careful. I would probably do a 40 millisecond delay on her based on her skin type. So we have a gentleman here, type 4 skin, who has small telangiectasias on his cheeks. We have the M22 with the NDAG attachment with a 2x4 millimeter spot size tip. And for his skin type, I would use a double pulse, 10 millisecond pulses with a 35 millisecond delay and 150 joules per centimeter squared. And that's fairly conservative. We may go up on that depending on how he responds, especially on the face. And if you look closely, the veins got just slightly darker, a little more purpuric. How was that pain-wise overall?
It wasn't bad at all.
Now we're going on to the resurface part of the treatment. We have our chill tip with a sapphire window. We have a lot of variability in what kind of spot we use, from a rectangle to a straight line to a circle to a hexagon, and also the size of that spot. So a lot of variability. If you're treating very focused small areas, you can adjust the spot size from extremely small to relatively large. We're going to be using a rectangle at 16 millimeters, 350 spots per centimeter square density, and 40 millijoules pulse energy.